spring of 2017 Diversity and Public Interest webinar series. That's a long title for what we've been doing all spring in Division 17, which is exploring issues related to social justice. So far, we have explored the Black Lives Matter movement and counseling and psychology, leadership and activism, social justice and early career professionals, and bringing social justice into leadership. We've also explored ways to address rising anti-Semitism, and today we will be talking about how we can infuse trans issues into counseling and psychology, supervision, and training. And this webinar is envisioned as a dialogue between supervisees and supervisors. So we're really excited to have all of you with us joining the webinar. And I also want to give a warm welcome to our panelists. Wendy Gonzalez-Canal is a second-year doctoral student at Ball State University. She completed her master's in mental health counseling at the University of West Florida in 2015. She is currently one of our co-chairs for the student affiliates of Division 17, the student organization of the Society for Counseling Psychology. Wendy's clinical interests focus mainly on working with college students, and her research focuses on Cuban American women survivors of sexual assault. And Wendy uses she, her, hers pronouns. So welcome, Wendy. Thank you for being here and representing really both a supervisee and a supervisor perspective in training. Dr. Chang, pronouns are they, them, and theirs, is a Chinese American genderqueer identified psychologist, educator, and trainer. They currently work for Northern California Kaiser Permanente in designing clinical and cultural competence training for transgender health. They also have a private practice in Oakland specializing in trauma and EMDR, addictions, relationships, and healing work with marginalized communities, particularly people affected by the intersections of racism, homophobia, and transphobia. Sand currently runs consultation groups for therapists who work with trans and gender nonconforming clients, and Sand served on the task force that authored the 2015 American Psychological Association Guidelines for Psychological Practice with transgender and gender nonconforming clients. That's the document we're going to talk about today. Sand is also the past chair of the APA Committee on Sexual Orientation and Gender Diversity. And outside of their professional work, Sand is a dancer, musician, avid foodie, and pug enthusiast. I love that part of your bio, Sand. It's awesome. And my name is Anneliese Singh. I'm at the University of Georgia, where I'm an Associate Dean of Diversity, Equity, and Inclusion, and a professor in counselor education. I'm the Vice President in Division 17 of Diversity and Public Interest. I founded the Trans Resilience Project in 2009 to translate my research findings with the resilience that transgender people experience and navigate and develop in response to oppression and discrimination to lead thriving lives. I identify as South Asian, multiracial, and a Sikh American, and I co-led the APA Trans Guidelines Task Force with Dr. Laura Dickey. That was a 5-year process, I think. And as a presidential initiative in the American Counseling Association with the Division of LGBT Issues in Counseling, I worked on counseling for competencies that were really training competencies for counselors. And I have an NIH study that looks at trans resilience and risk with some co-collaborators, Walter Bakhtin at Columbia University and Alan LeBlanc at the University of San Francisco. I use she, her, and they, their pronouns. So we have 3 panelists today. I'm facilitating. So I want to go in and get us started with today's webinar, just talking about a timeline of what's happened in trans counseling and psychology. And so just for about 3 minutes, I'll give you an overview. I think depending on how you're joining us today, you might be in education or another discipline, and there certainly will be some implications for what we're talking about. Because no matter what field you're in, working with trans issues, you certainly will be doing some education and or supervising. But when it comes to counseling and psychology training, and also counseling trans folks and non-binary folks and the helping professionals, if it feels like our fields are trying to catch up, They certainly are. I would say that this is my personal opinion, but I think as a field we're pretty behind in terms of where we need to be just to provide some basic trans-affirming health and mental health care. Some of you may be familiar with the WPATH standards of care. WPATH stands for the World Professional Association of Transgender Health. These standards of care have been around for a while, but I think there have been multiple problems with the standards of care over the years. The problems that still exist in the 2011 version of the standard of care, but mostly you can locate those problems to the fact that trans folks are not integrally I don't want to say integrated, but included position in places of power within WPATH so that the standards of care are defined by trans people themselves. It doesn't mean that trans people haven't given input. They certainly have, and trans activists around the world have really called for our fields to do better. So you've got first the WPATH standards of care, but when you look at those standards of care, they have little to say about supervision. Now, the standards of care, the 2011 version, and all the versions are available at WPATH's website for a free download. Now, the American Counseling Association training competencies are also available at ACA's website for a free download. And they really focus on 8 domains of practice. So if you are a trainer or you're looking to give or receive supervision, it can be a really helpful document to look at. It has an unabashedly feminist and social justice framework in terms of centering trans lives, and that trans people are in charge of their mental health, and really advocates for the removal of gatekeeping for mental health professionals. So you might want to check out those competencies if you're looking for something to just make some training change right now. And then we have the APA guidelines, which we'll focus on mostly today. The American Psychological Association endorsed these guidelines at the end of 2015. They are also available on APA's website for a free download. I think the contribution of the APA guidelines are really that there's a clear definition of what basic trans-affirmative counseling is. And we'll just leave it there, right? But that's at least a baseline we want to get to. There's a lot more to do. And the other contribution is that for each guideline of psychological and counseling practice, there's a rationale for that guideline, which talks about the research that leads us to this focus, but there's also an application. And I think the 10-person task force that worked on this document came from very different perspectives, different gender, racial, ethnic, training, academic backgrounds. So you'll notice that it really is a consensus document from many different perspectives. The guidelines are divided into 5 areas or clusters. 1, foundational knowledge and awareness, a great place to start if you are just starting to learn about trans issues. 2, stigma, discrimination, and barriers to care, talking about the significant experiences that trans people and non-binary people may experience as they try to live their lives. 3, lifespan development, so you'll find information on children, adolescents, young adulthood, middle adulthood, and older adulthood. The 4th section is on assessment, therapy, and intervention. So those clinical interventions, how you use assessments, how you work with parts of therapy and counseling that were never normed or really designed for trans people. How do you navigate some of those parts of training? And then the part we're most interested in today, we're actually interested in the whole document, but where the guidelines actually say something about supervision is in the 5th section in research, education, and training. I'm going to read Guideline 15 because many of you may be involved in research or supervise research. We won't focus on 15 today, but Guideline 15 says that psychologists respect the welfare and rights of trans and gender non-conforming clients in research. So I wanted to read that because it really gets at the idea of what we do in practice training, which is Guideline 16. Psychologist, or you can insert whatever your helping profession is in that blank, seek to prepare trainees in psychology to work competently with TGNC people. The ethical principles of psychologists and the code of conduct include gender identity as one factor for which psychologists may need to obtain training, experience, consultation, or supervision in order to ensure their competence. So even in this extensive document, and even though there are several documents in terms of mental health with trans folks, you can see there is still a lot of room to comment on the supervision aspects of providing basic trans-affirming work. We don't claim to know it all as participants, but we do claim the importance of starting a conversation between people who supervise and people who are supervisors, so we can really start to take ethical responsibility for the work we do. So that is my general overview for the webinar today. Again, thank you for joining us. And right now I'm going to volley it over to Dr. Chang, and they will talk a little bit about the supervisor perspective in using the guidelines.
Thanks, Anneliese. Hi, everyone. I'm really happy to be here, and I'm really passionate about training and really supporting people in the field in being able to provide affirming care to trans and gender nonconforming clients. I'm just going to talk a little bit more about some of the main issues that I see coming up as I am providing training to trainees, or to, actually I do a lot of training of licensed professionals as well. And Anneliese mentioned a lot of these issues already, but the first thing is just really a lack of training. I know that for me, when I was going through school, there was not one mention of transgender aside from saying LGBT, but the T was very silent. And so I think because many professors, many faculty don't actually know how to provide this training, they may focus a little bit more on gay, lesbian, maybe even more on bisexual, but transgender is not included all the time, even though gender identity is under the list of what many psychology programs require their diversity training to include. So this lack of training, I felt this split in my personal and professional life, and I felt like, wow, no one is talking about this in my professional life, but I'm very steeped in this in my personal life. And I think that it's been, several years, many years since then, but I think that still applies, and that plays out in the counseling situation where a client might come in and have no idea if the counselor knows anything about what it means to be trans, and are likely coming in with a lot of fear or probably previous negative experiences with medical and mental health professionals. And we know that from survey research that I think it's a third of trans people have had negative anti-trans experiences when seeking medical help. And I think mental health is included in that. So just knowing that, that's something to keep in mind. Counselors often, if they're not aware of the many barriers that trans people face, including violence, including constant microaggressions, then they may misinterpret what's going on. And so supervisors can really support counselors in being able to educate themselves about the greater context of what's happening outside the counseling room in the client's everyday life. Something else that's really important that the guidelines do touch on are the need for counselors. This actually applies to the work that we do with all clients, but the need for us to do self-reflection, the need for us to really look at our own positionality, our own areas where we may have privilege, our own areas where we may have experienced discrimination or bias, and to really understand the power that they may hold. For example, for cisgender counselors, they will really want to be aware of the dynamic between, and the power dynamic that they hold between themselves and their trans clients. For trans counselors, they will want to be supported in working with people who may have similar experiences or different experiences. So really helping the trainee to understand their own personal reactions based on who they are, the power they hold, and how that plays out. Something else that is also really important to keep in mind is that the training or the information that most people have access to really reinforces what we call a medicalized narrative of trans experience. And that really is that there are these misconceptions that all trans people have the same goals or the same transition pathways, that all of them want to medically transition, that everyone wants hormones and surgery. So there's this so many assumptions made as soon as someone says, I'm transgender. And we really want to move away from that, including incorporating understanding of non-binary experience, understanding of people who don't medicalize. And then last, I'll just mention that when working with trans and gender nonconforming communities, it's important to keep in mind that that you'll be working in small communities, and there are a lot of dual role and dual relationship issues that come up, and that counselors can, that supervisors can really support trainees in how to think differently about dual roles. I'll give you an example. I had an intern that I was working with, I was supervising at one point, and she started working within queer communities, and she said, well, I can't really go out anymore because that would be unethical. And I said, wow, that's like, you can't go out in queer community. And I really supported her to think about what that meant, and that, you know, we have to live our lives. And even if you're not part of those communities, you'll be interacting with people who maybe you have clients who know each other, very, very small. So really thinking a little bit more broadly about what it means to manage dual and multiple relationships within small communities. So I will just stop right there.
Thanks, Sand. And, you know, I just want to remind participants that you can ask questions via your questions menu, and we'll make sure to answer as many of them as we can. And again, we really wanted this to be a dialogue, so hopefully you're thinking already, the things that Dr. Chang brought up, do I do that? Or are they saying something that I really need to think about, or I want to take to the next level? So to give the supervisees point of view, but also as someone who is being trained to do some supervision, we have Wendy. Take it away.
Hello, everyone. I'm also really happy to be here. I'm really excited. This is work that I do on a pretty regular basis. I'm one of my graduate assistantships here is as a safe zone trainer. So we do training for trainings for allies of the LGBT community. We have the regular LGBT safe zone, and then we actually have developed in the last couple of years a specialized ally training for individuals in the trans community, because we felt like kind of that lumping, kind of something that you mentioned, and the lumping it together kind of doesn't give it enough space. So my kind of me jumping into this this area, this population has been an interesting journey. I think I can relate to a lot of my fellow students and trainees in saying that I learned a lot kind of along the way, the learn as you go kind of thing, with getting a client and realizing, okay, now I need to know enough so that I can offer good service for this client. I was telling Anneliese I took this kind of question back to my board, my SAS executive board, and asked kind of, because I didn't want it to be just my perspective, but the perspective of students more broadly. And something that came up a lot was that oftentimes we didn't get the guidelines, whether it was WPATH or APA, we didn't get them from our supervisors, but actually from other students, from our peers. And I think that really speaks to how much we lack in training kind of everywhere, and that we're kind of like grasping at straws, trying to figure out how to provide these services in a way that is ethical, while kind of understanding that not everybody has this this training already. I know as a student it's really hard to focus on a particular population when you might have a caseload where people range from 7 and 8 year olds to 80-year-olds with like depression, anxiety, coming in for say like trans issues. So whatever it might be, so it can become really difficult to kind of focus on that one population to become an expert. So I think as students it's really difficult, especially when supervisors don't have that knowledge, that it kind of also falls on us to do that extra research, to do the extra things on top of everything else that we're already doing. And I think that's a little difficult. here at Ball State, we're kind of in a unique, well, maybe not so unique, but we're also trained as supervisors. And what some of the students in my board were mentioning is that as supervisors, they're having their own supervisees come in with these questions. I have a 13-year-old trans student, like what, or trans kid, what do I do? What am I supposed to do? What do I follow? And then it's kind of, well, we were never trained with that. That wasn't discussed in our supervision class. So how do we integrate that in? So I can see kind of like both sides. Like as a supervisee, it's really difficult because our supervisors don't have this knowledge. They didn't have this training. But also as a kind of a, like incoming supervisor, like, oh, I also don't have this knowledge. So how do I make sure that I'm being a good supervisor to my supervisee? I think a lot of the questions that came up were very concrete. Kind of if they're coming in for a letter, what do I do? When do I write that letter? Who do I write it to? What goes in the letter? What are the local or like statewide laws or regulations that we need to be aware of when working with this population? So very kind of like concrete things were the ones that came up. I think we receive enough training, like a lot of training in developing empathy, doing some of that introspection, acknowledging the power dynamics, and being able to kind of bring that into the room. But the more concrete things, you know, maybe what laws are out there right now that that might be affecting our clients that we're not aware of. So those were a lot of the ones that really came up a lot of times that a couple of people mentioned, like the very specifics, and then kind of how do we get our supervisors trained on this so then they can train us, kind of thing. You know, what do we do? How can we advocate for our clients, for ourselves, and for our supervisors? So yeah, I mean, I can provide more perspectives as a student. I can say for me, it has been kind of a journey with my own clients, which is kind of they bring up a question and I have to really admit and say, you know, I really don't know, but how about we table this for the next session and I can make sure to do that research, to look it up, and I'll bring it in. And so that's been kind of interesting and a little frustrating for me sometimes because I wish I had all the answers. I wish I could come in and be able to help in that session, not have to wait a week. But definitely a learning road here, a learning path. So yeah.
Thank you, Wendy. And you brought up so many good issues, I think, for Sam to start jumping in on, from letters and how the guidelines may help with letters. I think the fact that students had so many questions about just the concrete details are really interesting. And then there are the bigger training issues around, well, what are we doing as helping professions in terms of all genders, you know, not just for trans folks, but what are the ways that cisgender and transgender issues are really connected? So I don't know which one of those questions you want to take first, Sand, but I heard some need for some concrete directions and how to start getting this knowledge.
Okay, so well, I did want to just jump back to something you said, Wendy, about sometimes feeling frustrated at not having the answers within that session. And I really think, you know, none of us have all the answers, and it's so important, and trans clients will so appreciate it when a counselor says, I don't know. And the worst thing is when a counselor acts like they know everything and then they're making microaggressions right and left, and so I think that's very appropriate. And when it comes to the letters, so this is I could talk forever about this. So with the letters, I really like to emphasize that the most important thing is the conversation that is had between the counselor and the client. And the letter is really a product or kind of a document that reflects that conversation. And so I think sometimes I have people say, how do I write a letter? And I think, wow, it's a really long answer. And it does require much more familiarity, including more familiarity with the kinds of things that we want to encourage our clients to be thinking about when preparing to give informed consent. So Anneliese mentioned WPATH, and they do have the standards of care. It's version 7. It came out in 2011, and there's a lot of controversy and a lot of mixed feelings and opinions about WPATH standards of care and how affirming and inclusive they actually are. I think they've improved over the years, but they still aren't totally client-centered. And so what happens, and because there's a very little information about exactly how to write these letters, there's requirements, people are doing like a whole gamut of things. And so I have just my personal and perspective that is informed by social justice, which is that our job is to support the client, listen to them telling us what they need, and really support them in being assessing capacity to give informed consent, supporting decision-making capacity. What I don't get myself into, which I think is a very common error, in my opinion, again, is to assess if this person really is who they say they are. So it's not my job to decide for someone if they're trans, if they're a man or a woman or anything like that, but I think that's what goes into a lot of letters, is these very lengthy gender histories that kind of serve to like make the case for why someone is a woman. Like she played with dolls, which is just so, to me that's not really a good measure of, does this person know what they want and what they're choosing? And so that's the way that I conceptualize letters. I really encourage trainees, if you want to provide the service and your supervisor doesn't know anything about it, to seek outside consultation. It's one of the reasons why I provide gender consult groups, just because there's so much that goes into a letter and into that conversation, including knowing more about the medical preparation and recovery than most of us as counselors ever really think we're going to get into. So that's just my opinion. And one more thing is that what we're doing is advocacy, and one of the guidelines is about advocacy. So when we write letters on behalf of our clients or talk to a doctor and advocate for them getting what they need medically, that really is it's an important role.
So how does that sound, Wendy?
That sounds good, and it actually you kind of reminded me of a conversation I had with a client saying that they went to a clinic and they felt like they needed to prove how trans they were, that they were trans enough to get the hormones, to get the medical care that they were seeking. And I can kind of see that being very similar if we're writing a letter trying to make that argument. So kind of like, I like what you mentioned about kind of getting away from that, because that's not what we're there for.
Right. There's also really varying opinions on how you define the capacity to give informed consent. So I mean, this is just such a longer conversation, but questions about, when mental status is impaired, or if there's really active substance use, those sort of things. And I'm actually not someone who believes in no, never. I believe in, okay, how do we support this person to be in a more stable place? Do they have support? Do they have a place to live? Those sorts of things, or the psychosocial things, are much more important in that assessment.
I love it. This is exactly what we were wanting, some dialogue between supervisees and supervisors. And just to kind of go out for a bird's eye view of things, I think what we're doing right now is really relevant to social justice work with any marginalized communities. Imagine if supervisors and supervisees are talking with one another about the training gaps, and if we who are in charge of training are seeking to integrate what students have to say, not just at the end of their evaluation or mid-year evaluation, but to really bring that in. I think, as Wendy was sharing before, a lot of the ways that people are getting trained or saying, hey, I need to get trained on these things, are being led by students and folks earlier in their career. And that is a little dicey proposition, considering that most folks who are in a student role or a trainee role don't have as much power as we do as supervisors. We have a lot of fantastic questions coming in. I want to add one thing about letters. I would say that we've got some good research that lets us know that if people are coming in to access some type of medical intervention, we know that the more we can remove barriers in terms of the letter writing process, the better client health outcomes are. So it can give you a huge sense of relief when you realize that your role really isn't as a gatekeeper, and that we can move away from that type of supervision model and move towards a more empowerment-based model where we can all imagine what it's like if we wanted to access medical intervention and we had to go through a mental health therapist. So some of those early conversations with supervisees and with supervisors can be, okay, how does it feel? Do we feel like we're going out on a limb here by taking this approach that's less gatekeeping? And where are those thoughts coming from? Are those thoughts actually grounded in research and in what the field is saying ethically we need to do? Again, a lot of the research says that for folks who need to access medical interventions, anxiety goes down, mental health issues go down, depression goes down, suicidality goes down. It's like thumbs up, thumbs up, thumbs up. So, but I think we get into a trap when we feel like we are in charge of making these decisions for clients, and all of a sudden we're facing a really big burden. So I really like what you're both saying about facilitating client empowerment. You are getting like a point of gratitude from the president of Division 17, so that's awesome. But the next question is, one of the things that one attendee finds is how to bring up issues of gender nonconformity and trans issues in the initial assessment. And I've got about 4 to 5 other questions, so we're going to prioritize those. So who wants to chime in on
that? I'll speak to it. I think it's important to bring these issues up or make openings for people, trans people or non-trans people, cisgender people, to be able to talk about gender. And so one of the best things is just to have, like if you have intake paperwork, to have gender identity and pronouns on there that often can open up the conversation, or just asking, you know, when you're asking a number of questions. So how do you identify in terms of gender? I don't want to make any assumptions. What pronouns do you use?
Yeah, I would say, kind of second what Singh just said. For me, I've always been taught kind of the more nonchalant you are about it, the more clients are willing to kind of go with it and find less threatening. And even if you have somebody who has like a strong reaction to that for some reason, kind of have a conversation and use that as a moment to educate. This is kind of coming from some of my safe zone training tips.
Another thing to think about is that we want to open the dialogue for all identities and all aspects of a person's culture that really affect their experience. And so you could always just start with a really open question, like, I hear that there's a lot going on for you around XYZ, whatever is going on. And I really want to invite you to bring your whole self into the room. So if there's anything going on for you that is affecting you around any of your identities, whether it be race, gender, age, religion, and really invite you to bring those into the room with you.
I love those responses, and I think you know, the more explicit we can be is what I hear you both saying with clients, and that's why I love the question. It's like right from the gate, like kind of saying that, you know, there are all these identities that can influence our mental health. And the best news, folks, is we have research that says they do. We know racism hurts. We know that the mental health stressors that trans people and non-binary people face have huge consequences, right? So we actually have license to do the work and to be explicit in the first case. But I think some of this comes back to our own gender reflection too. So for instance, if we identify as cisgender or as trans, as a supervisee or supervisor, kind of checking in with ourselves regularly with a consultation group, with supervision, kind of seeing where we are with those things, because we've all been taught in some ways to be gender negative, to hide different parts of ourselves or to overemphasize some parts of ourselves that may not fit. So I really appreciate the concrete answers you're both giving. I think there are a couple of questions about, I know, Wendy, you were talking about a dual role, and I know you were talking more as like, you know, a supervisor, but also you're a supervisee in training, but you're also training to be a supervisor as well. But there are dual issues about trans and non-binary people entering the mental health profession, entering as providers, entering as supervisors, entering as supervisees. So I was wondering if you both could speak to that. Is that how can you discuss how supervision might be different with trans-identified clinicians in training is what the question is.
Mm-hmm. So when working with anyone, really, I want to help them look at the dynamic that's happening between them and the client. And so with trans-identified trainees, and I think it's so important that we're even talking about this question, first of all, because there's this like false dichotomy that trans people are only clients or often just mischaracterized as activists rather than providers. Like when they're providers advocating for other trans people, we are usually characterized as just activists. So that's just, I just want to say it's important to just like acknowledge that. But when working with a trans trainee, looking at, well, what are the feelings and reactions that are coming up for them? How can I support them? When it can be challenging to work with cisgender clients or to work with trans clients who push their buttons in some way. Like I remember, you know, I've had worked with consultees who are trans-identified, who were more non-binary, feeling very sort of having a lot of feelings about very strongly binary identified clients. So supporting the understanding of like a really wide breadth of experience, even if it's not your own, even if it's not what you would choose, or even if the language that the client chooses is something that you would never choose to use for yourself, that sort of thing.
Yeah, I would say like that makes me think of kind of how I bring in my own identities as a Latino woman and how I might discuss that in supervision. I haven't had a lot of experience as a supervisor, but I can imagine opening that conversation up kind of in a similar way that Sam was mentioning, saying bring all of yourself into this room and let's analyze and let's see what parts of these things of your identities are impacting you in a certain way that might be hindering or enhancing your work with clients. Like how can we use what you have, the tools that you normally bring in with you, to your favor?
I appreciate that. And I would also add that, you know, at the beginning of our training programs, we can really locate gender and these other identities earlier on in training. And even if you haven't done it, we're here at the end of the academic training year, right? You might be like, darn, I forgot to do that. I mean, it's never too late to stop and pause and say, hey, you know, there's a lot of stuff going on in the world. I think most people who are on this webinar have been doing this, right? But to be really explicit about that, people who experience marginalization, we can try to be the best helpers we can. But it's so important for us to look at our own identities first so we can do the self-reflection work and know how to possibly do the empathy work. And what that means is often doing an assessment of our training clinics, our training materials, our admission materials. Are we still having kind of a really gender binary showing up at our universities, at our community mental health training sites, at our private practice training sites, at our other training sites? You know, when people are coming in the door, what do they see? Do they see a door that's opening, or do they see a door that's shut? And they just know at that point they have to, you know, put on their resilience boots and keep marching through. But I think those initial assessments of our training, even at the end of the year right now, the training environment can be huge. We already have great research that says what we know trans and non-binary folks are going to experience. Being highlighted, being asked what pronouns they use, you know, people may be sidestepping and feeling like, ooh, I don't want to say the wrong thing. But what if we all had permission to talk about the pronouns we used, not preferred pronouns, but because I always say I prefer cream in my coffee. I don't prefer the pronouns that you use to reference me, but the name and pronouns and other parts of our identities that are so important. Then we start getting trained into that model. All the other things that the guidelines write about are really important. So I want to shift back to kind of a consultation question. One attendee is asking, how can you find an outside person to consult with about letters if our immediate supervisor is not very well versed? And before you jump in, I'll just remind folks that this is a recorded webinar, so this will be available for viewing later.
There are a number of professionals, gender therapists, who provide consultations, sometimes even via like Skype or online, and so that's something that you could always look for. I know that there are at least a few that do provide that. I only provide in-person groups at this time. And then there's some like Facebook groups, social media kind of resources that might be able to support as well. And I also really encourage people to go to conferences. So there's the next one that I'm going to is September, the Philadelphia Trans Health Conference. In November, UCSF is having their Trans Health Summit that happens every other year. There's Gender Odyssey. I mean, there are a number of conferences. For youth, if people work with trans youth, Gender Spectrum is a really good resource. So those are great ways to get all this additional training that you may not be able to get in your immediate training environment.
I would also say, not in regards to trans, but this is something I've done within, say, the National Latino Psychological Association listserv. I have sent out, you know, kind of questions saying, hi, like, I don't have this knowledge, my supervisor doesn't have this knowledge. Is there anyone who can help or who can give some guidance? And I've, in that listserv, I know I received a lot of very supportive and encouraging feedback, and people saying, like, I'm willing to, like, consult with you pro bono. So I would say make sure that you use listservs. That's what they're there for you to reach out. That's why we have the internet, right?
Yeah, and I find that, you know, this is why we did this webinar, because I think we've all been being as creative as we can, and we find the ways we get frustrated, whether we have a little knowledge or a lot, or somewhere in between about this. So I really appreciate us all being on the journey together and seeing that there are a few other steps we want to take. I have two questions. One returns to the scenario of a trans supervisee and you know, how to work with trans supervisees who also may be in training in a rural area where the supervisee also needs supports from the trans community. It kind of brings up multiple roles. And then the second question brings us back to documentation. How do you supervise around the medical record regarding names, pronouns in a way that facilitates interprofessional communication and is also trans-affirming? So I gave you two questions to think about. Let's start with the first one, a trans supervisee in a rural setting. What supports can you suggest?
Again, I would say get connected to other trans therapists across the country. There are a number of, there's groups on Facebook, there's a trans, like a Yahoo list that's a trans therapist list. There's something called TPATH that just started, Transgender Professional Association for Transgender Health, I believe. And so, yeah, there are different resources, I would say, to help to reduce some of that isolation. And I think it's also important to just do work on, I mean, really it's boundaries work. Really figuring out how do I exist in my community and find ways to not limit the support that I need and to have that conversation with clients. And I work in lots of small communities, so I have that conversation a lot. Like, you know, I know that we have social overlap, you know, having that conversation about if we're at an event together, or let's talk about how that's going to affect us given that we share community.
Yeah, I would second that. I've had those. I've run a LGBT support / process group here, and that has been often part of the conversation with the group members. Before that, I have run process group in which we say, like, you cannot be friends outside of group, like this is like group time, kind of setting those boundaries, and those boundaries have to be a little bit more flexible when you're talking about being a part of the community when you do need that support. So having that conversation and coming between clients themselves, and then if you're part of that community, I would say including yourself in there, how are we going to handle this? What is going to make kind of both of us or all of us comfortable here, and what are some of the boundaries that we can cross, kind of making that very explicit from the get-go.
Another thing is that this divide between healers and their communities is really a very Western-centric divide. In many cultures throughout time, healers have been part of the community, and I think that has to be the case for people who are trans providers too.
I love the responses and love this discussion, and I would just add that I think being as explicit again as you can. There may be people from other marginalized groups or people who are strong allies who you can connect folks with. And just as you both said, the online community now is very powerful, and I think the three of us would welcome if you had any questions to that we could help you get connected with consultants or kind of people who are also in rural networks. I think the other question was the one about documentation, the medical record, names, pronouns. How do you do that when you're working with supervisees, supervisors, and clients in a way that's trans-affirming, right? Mm-hmm. We've got all these boxes. I think this is probably about intake paperwork, and we go to enter things in the record and there's a gender binary. What do you do in those cases?
Well, first thing I do is advocate to get rid of the binary and say, I can't work with this, and you know, really helping the system. And I know it's hard. Sometimes it's an IT issue you have to work with, but really that's a really great place to put advocacy energy. And then with documentation, just always using the name and the pronouns that the person uses. And I've gotten this question a lot. Well, what if the medical record says this in the note? Don't we have to use this name? And no, we don't. We can easily find the person, identify them. The name is in the chart. Just we use, you know, the name and the pronouns that the person uses for themselves. And that includes when sending staff messages, notes, or talking about the client when they're not there.
Yeah, and I was actually thinking about that, kind of getting rid of the binary, because that's something that as students and as trainees we can advocate for. That's something that we're doing here now as the end of the semester and kind of the feedback forms and the review forms come out. That was one of the things that we did. We said, hey, did you all make sure to correct this from last year when there was a male-female box? Like, did you make sure to alter that so that members of the LGBT community as a whole feel more included or don't feel like they don't belong, kind of thing. And had something else and now I kind of lost it. But yeah, kind of like as students and as trainees, that is something that we can certainly still advocate for. It might feel a little weird. I know it sometimes does, kind of going to people who have more power and saying, hi, kind of need to correct this, or is there any way that we can make this more inclusive? But kind of seeing that as a point of advocacy, as a place where we can make a difference.
And I think one thing that's almost like a dirty little secret of our profession is that it is very true that supervisees have less power, but I think a lot of times supervisors are dealing with power dynamics above them, where if they are able to say, like, hey, these students are saying we need this, it's not an ideal situation to put trainees in. I just want to say that 100%. But I think often when we can say and advocate with higher level administrators, we need to do this for these reasons that are not only about research and being in accordance with the APA guidelines. You know, you can pull in professional documents, research, But often administrators, upper level administrators, once they hear it's a student issue, it's a student request, the conversation gets tweaked a little bit. And I would like our professions in the healing professions to get to a different place so that didn't have to happen. And that, you know, supervisee feedback was, you know, just kind of welcomed and integrated. But I do think that people who are social justice minded and training facilities can find ways. I know just from seeing the names of the folks who are attending the call today, I know folks have been creative in their centers, and I would encourage you to think about what's that next level you want to take your center or your setting or your own personal supervision. And if you're a student or a trainee, what is that thing you've been hesitant to ask for or learn about? It could be a good thing to learn about with your supervisor. So let's talk about challenges for a moment. We've got about 10 minutes left. I know you all have had some personal experiences, and I think, you know, sometimes those can help us figure out how to move through those experiences and make some change. One personal experience I had as a first year in my doc program is that, you know, it was kind of this way no matter where I've practiced. I worked with a lot of folks who identified as trans or non-binary. I think just wherever I went, there was a reputation that I was doing this work, I was doing resilience work. And so there was one time my supervisor was with me out in the waiting room, and he was joking with me, and he said, "Hey, I saw your client today." And I was like, "What?" I was thinking to myself, why is he talking to me about seeing my client today? And then I was like, oh, he's, you know, maybe never experienced a trans person today. And this is really messed up interaction. What do I do as a supervisee? And how do I kind of use the power actually that I have, even if I am, you know, a supervisee, to say something? And so I just used curiosity. I was like, oh, which client did you see? And then he started to fumble and kind of got into a web that he was able to realize. And it probably comes from some of my culture as a South Asian, multiracial person, allowed him to save face a little bit, but also set an idea and put it back on him. That wasn't mine to take care of. And if it continued, I really needed to address that. And I've thought about that example many, many times as a supervisor, because I really want to make sure that I'm talking about gender in general from the beginning of our relationship. So supervisees are never put in that position because it was bad for me as a supervisor or a supervisee, but it was way worse for a client who I'm getting inadequate supervision on their case and how to best work with them. So I wanted to throw it back to you two and see if you could share a personal experience that might give some direction and some ideas, get us thinking about what we can do in supervising and training situations.
Immediately, kind of what comes to mind for me is more so in my role as a trainer or presenter in our safe zone trainings. And especially this year, we've gotten some interesting feedback. A lot of people saying how much they love it, how much they like it, and also some pushback that, you know, as a cisgender heterosexual female, that it might be better if the training is run by someone in the community. Or so kind of that led to us for a discussion about kind of how to remain an advocate but not take the space away from people in the community to share their own stories or to be able to have their voices heard. And I think in supervision, that's something that might also come up, which is what if the client is requesting someone who identifies as non-binary, and kind of how to handle that as whether you're the person, you know, who did the intake and or the supervisor making the decision, or the supervisee that gets assigned that case if you're not in the community, kind of how to have that conversation. So yeah, I mean, I think it's really hard. I think we're constantly walking this gray area and there's no right answer. But I think as long as we're being honest and introspective and kind of being clear with kind of our intentions and the position that we're in, then I think that's kind of the best that we can do.
I think that is a really tricky situation when there's a very specific request, and when that request can't be met because that counselor doesn't exist in the system, then I always wonder, does that counselor exist elsewhere? Can we support that person in accessing those resources elsewhere? Or being very sensitive when saying that that doesn't exist, because I've definitely heard stories of people being told, well, that doesn't really matter. All our counselors are very competent at working with trans people, and that's like a cop-out, and not really very respectful. So yeah. And then just to speak to the question of challenges when working with trainees, and I do a ton of training too of medical professionals, and I would say that one of the main things that I like to get across is just thinking about impact over intention. There are so many people who are well-intentioned but not very versed in or up to date, and things of course are always changing, and so it is that person's responsibility to keep themselves current. But just really looking at what sort of biases might keep someone from learning. So I'll tell you a little bit about the ones that I think about. One are the overly eager, maybe savior complex that can come up, which then stops like a depth of listening, because someone just wants to sort of be good and liked. Another thing that can create problems is like a faulty assumed in-group experience. Like if you have a lot of trans friends, or your partner is trans, or you're LGB, that creates sometimes a false sense of like, I know everything there is to know about trans people. And then another challenge is that so much of what we read and talk about when it comes to trans anything is very based on usually white, able-bodied, middle-class people, access to a lot of resources, and really not looking at how much especially trans people of color don't get included in the conversation. So I really make a point to find resources to talk about really what trans people of color face when I'm working with trainees.
Thank you both. We are getting close to time. We have just about 2 minutes. So if there are any other thoughts, Dr. Chang, you were kind of heading in that direction where you're talking about just some overall practical views, but are there any last thoughts on this, dialogue between supervisors and supervisees about how to really integrate trans-affirming training more into practice? Probably have about 30-ish seconds each.
I mean, as a supervisee, I would say kind of bring in questions of what you need. Right? When I brought it to my board last week, a lot of the questions were very specific. And if that is what you need, if that is what the need of, say, your cohort is at that time, maybe it can be turned into a training that the department receives, right? So noticing that a lot of those needs that you might have, you're not alone in that. Like a lot of other people are going through that. So kind of like standing up and saying, hey, I need this, and I'm wondering if other people do too, and kind of advocating for that.
I think that's that's exactly what I would say is just when you recognize there's a need, how can you create a resource? If you're needing help, then the other supervisors or other people around you are probably needing some help too. So creating a training, inviting an outside speaker, all great, or watching something all together, that would be another good idea. There's a really good film I actually often recommend people to watch. It's called Diagnosing Difference, and it's about it was made about gender identity disorder, but it's about mental health and gatekeeping, essentially.
Awesome. Well, thank you both. I think I shared one of my earliest training experiences, and I was thinking about that stage of my life when I really hoped and wished for kind of an area like this, a space where the questions could be asked, and we didn't maybe solve all of the problems in trans-affirming training in 1 hour, but I think if people can really commit to that next step and really maybe be that consultant to another center near you. If you're working in a rural area, kind of doing some assessment to see how you can increase the trans pipeline community-wise and trainee-wise in your area, but making sure you have the support you need. I mean, I think there's so many things we can be thinking about as a field to really make the world a better place for trans people, so they don't dread times that they work with us, but the time they spend with us is actually reminds them of the treatment that they should be receiving in the outside world. I really, this discussion has helped me continue to imagine a world where everyone is trained on these issues. So thank you for your work in the world, Dr. Chang and Wendy Gonzalez-Canal. I really appreciate you both so much. Thank you to all the attendees. This is a webinar that is recorded, and it will live on the Division of 17 Society for Counseling Psychology website. So if you want to share this webinar with a friend, if you want to review the webinar with some of your staff as a way to start discussion, there are multiple ways that you can use this venue. Please be in touch if you want to get involved in social justice issues within Division 17. And for now, we'll sign off and say thank you.
And thank you, Anneliese.
Thank you.